One of the changes that I noticed, I was a little bit surprised just at the number of kids that seemed to be struggling with different kind of behavioral and mental conditions. I remember the last 2 weeks of the school year, last year in 2017, a lot of kids were getting anxious and kind of depressed about school ending. And that, for me, that was such a contrast because I couldn't wait to get out of high school for the summer when I was a kid. And so I started to ask questions about, well, why is this scary? Why is this overwhelming? And some of the responses I got from the kids were things like, I don't know where I'm going to eat twice a day. I don't like to be at home because of some of the things that go on there, or some of the lack of structure or social engagement.
When I was being treated with my head injury, I had also told them that I had a history with depression. I had a rough childhood growing up. My immediate family was drugs and alcohol, so it was a constant fighting. I had gotten taken from my mom and put in foster care, and at that time, my dad had been deported to Mexico. While I was in foster care, I had gotten bullied very bad. I suffered a lot from just my past experiences and not being able to let go. And I had fallen into a really deep depression between like 6th grade to like 9th grade.
Every school year, the beginning of school year, like, it's been an anxiety attack. And I was like, okay, so what's wrong with me? So I came to the school-based health center. I talked to Dr. James, and I told him that I wasn't feeling myself, that I didn't know who I turned into, and I don't know how I got there where I was. But my dad, I just wish he understood how I felt. Until one day, I wanted to end my life, and he got me, and he's like, hey, I'm right here, calm down. We talked it out. And I'll tell him everything, and he would say, okay, I know how you feel, but here's how we're gonna make it better.
I've always wanted to start a club. It's more of a support group now, and people who think that they're like outsiders, or like they're just too depressed, or they can't fit in, or something like that, that's a safe place for them, and nobody will ever judge them.
Yeah, so when Mireya came and told me about the fact that she started this support group, I was excited for her, because I saw something changed in her. She mentioned that she had always planned to be a doctor, and now she wanted to be a therapist or a psychologist someday, so it's like, all right, and that was awesome.
I've changed a lot since I started that group. I've become more like accepting with people, and like seeing them out in the halls with like their headphones in and them just looking down and depressed. But after school, they have that hour to hour and a half where like their eyes light up, and it's like a different smile, and it's some place that they can go and hang out and make friends and like feel better about themselves. It's changed my future dramatically. I go from day to day like, how can I help somebody else? And with that, I can help myself.
The ways my mental health has influenced my art was by making the invisible visible, pretty much capturing what I have in my head.
The fact that mental illness is typically invisible, I love that Vanessa said that her art makes the invisible visible. And I think that's one of the things we have to do and have to look for. And I think that's one of the things that we're able to do with the assessments, with our services, is we look for it, we're respecting it, and then we're able to then treat it, offer services, try to make a change.
We offer the services to the adolescents in the high school so that we can get them during an early period of time in their life where we can hopefully have a positive impact on them. It's also important because they are getting their medical care, and we are really focused on wanting to give them the treatments that they need or the services that they need for their health and well-being, which includes their physical, but as well as their mental health, their emotional health.
A lot of times people do see mental and behavioral health as secondary, especially to the medical or physical health. One of the things I love about OneWorld, and the reason I was very excited to come work here, was our integrated model, where we really respect both things. That in some senses, if you're not treating both, or at least looking for and helping manage both, you may not really be effectively treating either.
There are so many good reasons for us to be here, and the primary reason, I think, is because as here, as an insider, we become a part of their school system. We become part of, the clinic that they see as they walk in the hallways, and we become kind of a normal part of their environment. And so once they accept us as an insider, they're more likely to come and reach out to us. They're more likely to stop in during a crisis in particular.
We can see the impact, we can see the change that is truly happening. And I think that will just continue to move forward into the future. And I love that we're able to say that we were part of it.
They're so nice. They care about you so much. And that just brings my heart joy, because I thought no one would ever care about me. And without them, I think I would have been gone.